My name is Paul Kielstra. I work with the Economist Intelligence Unit, and I was the writer of the report on the Mental Health Integration Index. The biggest challenge we faced was getting accurate and comprehensive and comparable data across 30 different countries. Quite frankly, there's very little information in some countries even on the prevalence of various types of mental illness, let alone on treatment rates, etc. We also, in most countries, had very little, if no, information on outcomes. Most of the medical information we had was on process treatment. One of the results of this was that our index is very heavy on the policy side because it was quite simply easier to see, do you have a policy that seeks to do this? Do you have a policy that seeks to do that? Where there's much less on the ground is seeing the extent to which those policies are even implemented, or let alone looking at what the outcomes of those policies are. The burden of mental illness in Europe is substantial. 38% of people living on the continent have some level of mental illness at some point during a year, from the very mild to the very, very serious. Of those, only about a quarter are being treated, and 10% are receiving treatment, which is described as notionally adequate by academics. The economic cost is also substantial. Most studies show that it's somewhere between 3 to 4% of GDP, and the most recent good Europe-wide study showed that it was 3.4% of European GDP, which comes to 461 billion euros per year.